Adrenal insufficiency causes, symptoms, and treatment. Adrenal insufficiency, also known as Addison's disease, is a condition where the adrenal glands, located on top of the kidneys, do not produce enough of the hormones cortisol and aldosterone. These hormones are vital for regulating many bodily functions, including blood sugar levels, blood pressure. 1.1 Primary adrenal insufficiency. Addison's disease. This is the most common type of primary adrenal insufficiency and is caused by the body's immune system attacking and destroying the adrenal glands. It can occur at any age, but it is most common in women between the ages of 30 and 50. 1.1 Primary adrenal insufficiency. Infections. Bacteria, viruses, and fungi can cause inflammation and damage to the adrenal glands. Cancer. Tumors of the adrenal glands or tumors that have spread to the adrenal glands can cause adrenal insufficiency. Inherited disorders. Some rare genetic disorders can affect adrenal gland function. 1.2 Secondary adrenal insufficiency. Isol. Long-term use of high doses of isol can increase the risk of adrenal insufficiency, especially during the early days of treatment. Ketoconazole. Continuous treatment with high doses of ketoconazole can lead to acute adrenal insufficiency. 1.2 Secondary adrenal insufficiency. Rifampicin. This drug is a liver enzyme inducer, which increases the breakdown of cortisol into 6-hydroxycortisol, reducing cortisol levels in the body. Other enzyme-inducing drugs like cardinal phenobarbital and dihydrophenatoin can also cause adrenal insufficiency. 1.2 Secondary adrenal insufficiency. Cholesterol buildup in blood vessels. Cholesterol buildup can block the blood vessels supplying the adrenal glands. Adrenal artery or vein thrombosis. Thrombosis can block blood vessels, reducing blood flow to the adrenal glands. Fungal infections. Cryptococcosis can cause adrenal gland damage. 1.2 Secondary adrenal insufficiency. Total adrenalectomy. After surgery to remove the adrenal glands, the body no longer produces cortisol and aldosterone, requiring hormone replacement therapy. Surgery for pituitary adenoma. Surgery can affect the production of ACTH, adrenocorticotropic hormone, from the pituitary gland. 1.2 Secondary adrenal insufficiency. Sheehan's syndrome. A condition that occurs after childbirth, caused by insufficient blood flow to the pituitary gland, leading to pituitary insufficiency, including adrenal insufficiency. Trauma. Head trauma can damage the pituitary gland, leading to adrenal insufficiency. 1.2 Secondary adrenal insufficiency. Meningitis. Meningitis can damage the pituitary gland, leading to adrenal insufficiency. Ruptured carotid artery aneurysm. A ruptured aneurysm can damage the pituitary gland, leading to adrenal insufficiency. 1.2 Secondary adrenal insufficiency. Pituitary hemorrhage. Pituitary apoplexy. Hemorrhage causes damage to the pituitary gland, leading to adrenal insufficiency. Metirapone test. This test can lead to acute adrenal insufficiency, particularly at the end of the test. 1.2 Secondary adrenal insufficiency. Surgery to remove one adrenal gland due to a tumor. Removing one adrenal gland can lead to adrenal insufficiency. Sudden withdrawal of corticosteroid therapy. Abruptly stopping corticosteroid therapy after prolonged use can cause adrenal insufficiency. 2.1 Acute adrenal insufficiency. Nausea and vomiting. Diarrhea. Abdominal pain. Muscle weakness and fatigue. Low blood pressure. Rapid heartbeat. 2.1 Acute adrenal insufficiency. Loss of consciousness. 2.2 Chronic adrenal insufficiency. Fatigue. Muscle weakness. Weight loss. Loss of appetite. Dizziness. Low blood pressure. 2.2 Chronic adrenal insufficiency. Darkening of the skin. Hair loss. Irregular menstrual periods. Decreased sex drive. Mental disturbances. 3 Diagnosis of adrenal insufficiency. Blood tests. Serum cortisol levels. ACTH levels. Electrolyte levels. Serum cortisol levels. ACTH levels. 3 Diagnosis of adrenal insufficiency. Electrolyte levels. Urine tests. Urine cortisol levels. CT scan or MRI of the adrenal glands to determine the size and shape of the adrenal glands. Adrenal gland biopsy to determine the cause of adrenal insufficiency. Serum cortisol levels. ACTH levels. 3. Diagnosis of adrenal insufficiency. Electrolyte levels. 4.1 Acute adrenal insufficiency. Establish intravenous access to administer fluids and medications. Administer high doses of hydrocortisone or dexamethasone to replace cortisol. Administer saline solution to correct electrolyte imbalances. Monitor blood pressure, heart rate, and blood sugar levels regularly. 4.1 Acute adrenal insufficiency. Continue administering high doses of hydrocortisone. Adjust drug dosage based on the patient's condition. Treat the underlying cause of acute adrenal insufficiency if any. Gradually reduce the hydrocortisone dosage. Begin hormone replacement therapy with oral hydrocortisone or prednisolone. 4.1 Acute adrenal insufficiency. Treat the underlying cause of acute adrenal insufficiency if any. 4.2 Chronic adrenal insufficiency. Hormone replacement therapy. Take low doses of oral hydrocortisone or prednisolone, divided into multiple doses throughout the day. Adjust drug dosage based on the patient's condition. Use aldosterone antagonist medications if needed. 4.2 Chronic adrenal insufficiency. Take low doses of oral hydrocortisone or prednisolone, divided into multiple doses throughout the day. Adjust drug dosage based on the patient's condition. Use aldosterone antagonist medications if needed. Treatment of the underlying cause of chronic adrenal insufficiency. Treat autoimmune disease. 4.2 Chronic adrenal insufficiency. Treat infection. Remove adrenal gland tumors if any. Treat autoimmune disease. Treat infection. Remove adrenal gland tumors if any. Take low doses of oral hydrocortisone or prednisolone, divided into multiple doses throughout the day. 4.2 Chronic adrenal insufficiency. Adjust drug dosage based on the patient's condition. Use aldosterone antagonist medications if needed. Treat autoimmune disease. Treat infection. Remove adrenal gland tumors if any. 5 Notes: acute adrenal insufficiency is a medical emergency and requires prompt treatment to prevent life-threatening complications. There is no cure for chronic adrenal insufficiency, but it can be managed effectively with hormone replacement therapy. 5 Notes: patients should adhere to their doctor's treatment plan and follow up regularly. Patients should carry a medical alert card to inform healthcare professionals about their condition in case of an emergency. 6 Recommendations: if you suspect you may have adrenal insufficiency, see a doctor for prompt diagnosis and treatment. If you are taking medications that can cause adrenal insufficiency, inform your doctor so they can monitor you and adjust your dosage accordingly. 6 Recommendations: learn more about adrenal insufficiency to protect yourself and your family. Note: this article is for informational purposes only and should not be considered a substitute for medical advice from a healthcare professional.